first off, I think the biggest concept I want to get through, and I'm going to always come back to this, is the concept of healthcare versus sick care. When we talk about healthcare reform, we talk about finances, we talk about cost reduction. We need to know healthcare and sick care. Healthcare is something that everything and everybody does for any sort of health condition, we lump into one big sum, and now we're in this healthcare crisis, and now we have all these problems, and we're worried about Medicare, and we're worried about all these things and these new laws being passed. And the fact is that none of those things are healthcare. If we look at the way America has treated healthcare, it's not healthcare, it's sick care. When we look at the difference between healthcare and sick care, we look at a lot of differences in things that are done as far as procedures, as far as testing, as far as money being billed and money being paid and money being owed. And it's bankrupt our country, not to mention Medicare itself. So when we look at things today, I want to always go back to that concept of healthcare versus sick care. Healthcare, in order to understand, we need to know what health is. And if you look at what health is, despite all of the different definitions out there, if you look in the actual dictionary, health is not just an absence of symptoms, although everybody says that. You say, well, what is health? So what health actually is, as far as a definition goes, health is actually when you're able to function at 100%. So you optimize your function at 100%. That's what health is. That's totally opposite of what sick care is. When we talk about health and we look in the dictionary, it says health is 100% function. It doesn't say anything about symptoms. Nowhere in the word health is there associated with symptoms. It doesn't exist. Unfortunately, we use the word health and healthcare and we associate all the symptoms. And every insurance company out there and every medical procedure that's done is focused only on symptoms. And so when we look at the difference between healthcare and we look at sick care, we look at the way people are and have been trained at looking at problems that different people go through and how we treat those. Sick care, obviously, we're looking at, we wait until something goes wrong. We look at the fact that, we have health insurance, and we're going to use that health insurance, and when we go somewhere, that is going to take care of us. And we have no reason at all to ever take care of our bodies. We take our car every couple thousand miles and we get an oil change. But God forbid we as human beings take care of ourselves and do any sort of tuning up or oil changing, because health insurance is only for those things when something bad happens. And so when we look at sick care, we look at basically the procedure that the majority of people do, which is we wait for something bad to happen, or we go to our annual exam and we get our tests. And when those tests are positive, we're now in symptom state. And when those tests are negative, we're great. But that didn't really accomplish anything, because we can go every year and we can get tested every year and we can say, we're so healthy, we've got no problems, we're not in pain, and all of our tests are negative, but all along we're not doing anything to achieve health. We're just waiting for something to say that we're sick, right? And so when we look at healthcare versus sick care, I want us all to go back to that. And when we look at the different ways in which the body actually has health or loses health,